Hi, my name is Raylene Hollrah, and thank you for taking time to watch this video. I'm a two-time cancer survivor by the age of 40, and the second cancer I should have never had. I was diagnosed with breast cancer at the age of 33, and I had a bilateral mastectomy followed by reconstruction, and I chose an Allergan textured implant that was FDA approved. Yet at the age of 40, I was diagnosed with something called breast implant associated anaplastic large cell lymphoma. You almost got to take a breath after saying that. So the rest of the video, we'll refer to it as BIA-ALCL or ALCL. But the bottom line is, my second cancer was a man-made cancer, and it was 100% because of my breast implant. So why are we doing this video? Myself, along with 3 other survivors, have started a website informing patients about the risk of textured implants and the risk of ALCL. Again, I should have never had it, and our whole purpose is to make sure that other women know about the risk. And our first step to curing this cancer was getting them off the market, and that happened last week. Now, Allergan's was recalled from the market for their textured implant, yet there are other manufacturers out there that are linked to this ALCL or BIA-ALCL. So if you're watching this video now, you either know somebody or you yourself have implants. So what kind of implant do you have? If you have a textured implant, you are at risk. There is no information of a smooth-only case at this time, but again, this disease is emerging. So find out what kind you have, and there is a lot of panic right now, especially if you have a textured implant. So again, knowledge is power. So what do? Well, first off, don't panic. There are groups out there on Facebook, and we'll give you information at the end of the video where you can go and talk to other women that are symptomatic or just concerned because they have textured implants. But if you are concerned, I know the FDA has stated that don't get them removed unless you're symptomatic. But what does that really mean? What is symptomatic? Well, if you go on the website, you can see a video by Dr. Mark Clemens talking about the diagnostic aspect of ALCL. But normally it's a late onset swelling. It could be a lump, it could be a rash, it could be pain, it can be itching. But the bottom line is if you have a breast implant and you have a change in your breast area, the shape, the size, or it just doesn't feel right, you need to make an immediate appointment with your plastic surgeon. And if you don't feel comfortable with your plastic surgeon, reach out to a board-certified plastic surgeon or a plastic surgeon that is well aware and up to date about this emerging BIA-ALCL. So after that's done, if you are symptomatic, make sure you are pushing. If there's a mass, if there's fluid, this can be biopsied and it can be tested with something called CD30. And again, at the end of this video, we're going to have more information on where to find information about that. So then what happens next? We have a lot of work to do. There's a lot of women that still have textured implants, and we aren't going to stop. We need accountability from the manufacturers who put these out on the market and were aware of the risk of cancer. We need to make sure that they follow up and take care of the patients that still have them and the women that have already had it and been diagnosed with ALCL. There's a great social media presence, and if you go to our website, BIA-ALCL.com, you can find more information, including the NCCN guidelines that talk about ALCL, how to test for it, and what to look for. We can also get you in touch with the Facebook pages that we have where you can talk to other women that are scared about it, diagnosed with it already, or going through treatment. It's a safe place to talk, but we are here for you. And as I said before, I might have lost my chest, but I haven't lost my voice. And just because I had breast cancer did not increase my risk for ALCL. It was 100% because of the textured implant. So make sure you're informed, make sure you know your body, and make sure you go and talk to your doctor. There's a risk for surgery, so you might not rush to get this implant exchanged. But let's see what happens. But watch your body. Go talk to the doctor. I hope you found this video interesting and informative. There's still a lot more to learn, and we're not doctors, but we're patients. And we're informed, and we want you to be too. Thank you. Again, BIA-ALCL.com. And for more about my story, just call me ray.org. Thank you.